Hello everyone. So today our case of discussion is case number 1731 of ENT. A 30-year-old woman presents with slowly progressive hearing loss in one ear, later involving the other ear over the past 2 years. She denies any ear pain, discharge, or recent infection. On examination, tympanic membrane are normal. Tuning fork tests show Rene negative that indicate bone conduction is greater than the ear conduction and Weber lateralized to the right ear. She mentions that her mother had a similar hearing problem requiring surgery. What is the most likely diagnosis? Alpha otosclerosis, beta chronic otitis media, Charlie Wax induced hearing loss, or delta Meniere's disease? I am going to give you 5 seconds so you can answer this question by yourself. Yes, you got it right. The answer is alpha otosclerosis. Let's discuss why this is our answer. Our answer is alpha otosclerosis. What is otosclerosis mean? Auto mean ear and sclerosis mean excessive bone deposition. What happens in otosclerosis? It is a condition characterized by abnormal bone growth around the stapes in the middle ear, leading to the fixation of that bone and that lead to the hearing conductive type of hearing loss. Okay. And I am going to show you an image. Look at this image. Is the tympanic membrane, and we have three bones that are in the middle ear that are important for conduction of the sound waves to the inner ear. And this is malleus, this is incus, and this is stapes. What happened in otosclerosis is that this step is fixed onto the oval window, and movement is very important for the conduction of sound waves. If something happen here or the fixation of that step is occur, when the this condition happen, this is called as otosclerosis, and movement of the step is will be restricted, and this lead to the conductive type of hearing loss that we see. And in this case, what we see otosclerosis that present with slowly progressive conductive hearing loss. How we find this out? When we do the tuning fork test like Rene, which is negative, and Weber, which is lateralized, that indicate the conductive hearing loss. Okay, and also very important in otosclerosis, we have a family history, and she tell you that mother has a surgery back in the past due to some condition. So family history is a clue, and conductive hearing loss is a clue, which is common in otosclerosis. Let's discuss why not the other options were correct. Option B was chronic otitis media that usually present with ear discharge and a history of recurrent infections. That patient was denying that he do not have any infection. Option C was wax-induced hearing loss, which usually cause a temporary conductive hearing loss, but wax is typically visible during the ear examination. But here in this case, they have written that the tympanic membrane is normal when the examination was done. And the Meniere disease typically present with sensorineural hearing loss with vertigo and tinnitus, not the progressive hearing loss like that, and the history like that. And about the Rene test and the Weber test, I will make a separate video. If you don't know, just remember this. If we see a Rene negative and Weber lateralizing uh, to the ear that is involved, this is a conductive hearing loss. Okay. And let's discuss some other notes about this disease. Most common presentation is the progressive conductive hearing loss. That is one that we see in the case. First symptom is slowly progressive hearing loss. Early additional symptoms we see paracusis, villi. This is a condition very peculiar for otosclerosis, not mentioned in this case. But if you see this, please suspect otosclerosis. What happened in this condition? The patient hear better in noisy environment, but in the quiet environment, he is unable to hear clearly. Okay, and next point is most common site. This is the fissula antifenestrum. This is a part of stapes bone. In this image, you can see stapes has two handles. So anterior handle is called as antifenestrum. So Mostly autosclerosis happen here. When do audiometry? Now, audiometry show you a conductive type of hearing loss with a peculiar finding called as Gerhardt's notch at 5000 Hz. Just remember it. And tympanometry findings are normal as seen. It's a type A curve which is normal, and we see this the tympanic membrane is normal. Investigation of choice is CT scan of the temporal bone. Treatment of choice is stapedectomy with the prosthesis placement. What we do, we break the stapes bone and we place a piston in it. This you can find different videos on the internet about that. And the medical treatment, which is less common, which is used for slowing the progression of the disease, we use sodium fluoride to slow the progression of that disease. If they ask you, sodium fluoride will be the answer. And inheritance pattern that I told you, family history is very important. You see autosomal dominant type of pattern with incomplete penitence. Okay, that's all about autosclerosis. I hope there is no MCQ that is left. Everything I have written here. So just revise this video and you are good to go for autosclerosis. And for detail, you have a lot of other books and stuff. Thank you so much for your attention. And for more videos like that, please like and subscribe to our channel, Sword of Knowledge.